Welcome to EPSDT under Medicaid, presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide family-led organizations that assist families of children and youth with diverse health and mental health needs, as well as the professionals who serve them. We provide one-on-one peer support, information, education, training, and outreach. The information in this video is current as of April 2026. As with any resources or information, it's important to verify the information provided to ensure it meets the same needs as your family's respective situation. EPSDT is an important provision under Medicaid that's available to all children ages 0 to 21 years of age. The first three letters of EPSDT, the EPS, refer to the fact that eligible children are entitled to regular comprehensive assessments of their health or early periodic screenings. These assessments and screenings must include checkups in 4 areas: physical health, dental health, vision, and hearing. The purpose of these screenings is to find any problems or conditions as soon as possible so they can be treated and so that children receive necessary health care on a routinized basis. Diagnosis and treatment are the meat of EPSDT and are triggered by these screenings. Once a child is seen by their physician or provider and a screening reveals a problem, a diagnosis can be made so that an appropriate treatment plan can then be recommended and provided. Any condition or illness that is discovered during a screening must be covered by EPSDT, and it's important to note that conditions do not have to be new in order to be treated. Whether a child has Hoosier HealthWise, Hoosier Care Connect, or Medicaid disability with the waiver system, they are covered by EPSDT up until age 21. EPSDT covers hospital services like inpatient, outpatient care, or emergency room visits, physical health care like doctor visits, dental, vision, and hearing care, immunizations, tests, and x-rays, mental health care such as psychiatric visits, substance abuse treatment, and inpatient psychiatric hospitalization, pharmacy supplies like medications, diapers, and special nutrition. Additionally, it covers services like PT, OT, and speech, nursing, personal assistance as well as behavioral therapy, and supplies like wheelchairs, communication devices, diabetic supplies, and prosthetics may also be covered. Finally, other services like medical transportation and case management services may also be covered under EPSDT. Again, these are just a few examples and not a complete or exhaustive list of all coverages. Not all services are covered under EPSDT. Respite care, which is intended to give relief to a child's primary caregiver, is not covered. Personal care services are covered because they focus on meeting the child's needs and are not meant to replace the primary caregiver. Habilitation services help individuals learn or improve social skills and basic daily living skills such as dressing, eating, and cooking. Because these services are designed to support overall functioning rather than to treat a specific medical condition, they are not covered by EPSDT. Family members may be involved in treatment when their participation is necessary, but services cannot be provided solely for the benefit of the parents or caregivers. EPSDT also does not require coverage of experimental or investigational treatments. However, a state may choose to approve these services or items if it determines they would effectively address the child's condition. States only pay for services under EPSDT that are considered medically necessary. An unofficial definition of medical necessity is the decision by a healthcare or other related professional that a person's condition requires a recognized service intervention or a course of treatment be provided in order to address or improve their condition. There are, however, some gray areas into how this definition translates into specific situations. It can be difficult to convince the state Medicaid agency or managed care company that a service is medically necessary. However, deciding that a service is medically necessary should mainly be left to a child's treating provider. States have the right to review a provider's decision, and it's not uncommon for providers and Medicaid agencies and organizations to disagree on what is medically necessary. It's important to note here that individuals also have the right to appeal any denials. To get to the T in EPSDT, you'll need to get a treatment plan from your doctor. For an EPSDT service to be paid for by Medicaid, the service provider must be an enrolled Medicaid provider. Please be sure to check with your physician, therapist, or provider agency to ensure they accept Medicaid. Even if the doctor describes Indiana's version of EPSDT in terms of checkups and services for young children, know that all EPSDT programs are required to screen and treat all Medicaid-eligible children. If needed, a medical provider can get more information from your state's Medicaid office. Additional information on this topic, as well as others, can be found on the Indiana Family to Family website, inf2f.org. For one-on-one support, you can complete the form found on the Connect page on our website. Call us at 844-323-4636 or email us at info@inf2f.org.